from the top here. I'm so excited. We have Dr. Boyer joining us, a board certified neurologist who treats Alzheimer's disease patients and patients with tubular sclerotic epilepsy. And that's the type of epilepsy caused by mTOR dysfunction that the Cassava Sciences just filed patent for. Dr. Boyer, thank you so much for taking the time. I know you had patients this morning as well, and you made time for us. Thank you.
Yep.
Great.
Of course. My pleasure. Thank you for having me.
Terrific. Thank you. I'm going to launch right into it because I know your time is precious here. For people who don't really know your background, can you please tell us a bit about yourself and your background?
Mm-hmm. Yeah. So I was actually a chemical engineer for ExxonMobil before I went into medical school. So I have an engineering background, and I'm a board certified neurologist at I'm an academic clinical neurologist. What does that mean? So day to day, I see patients. I see patients and their families for a variety of neurological diseases, neurodegenerative diseases, including Alzheimer's is a large portion of that. Epilepsy as well, stroke are certainly big interest of mine that I see. And I work for an academic institution, so I'm an assistant professor. So education, so patient care, education to patients, families, medical students, residents, trainees who are becoming future doctors as well. So that's my day-to-day life, And just for full disclosure, I don't work for Cassava Sciences at all. I've had no contact. I don't work for any of their clinical sites or any of the testing sites at all with Cassava. Yeah.
Excellent. So great. Thank you very much for that. Excellent.
Mm-hmm.
I'm going to keep on rolling here. You mentioned you worked with AD patients and their families. Can you tell us about the state of Alzheimer's disease today? What is it like to diagnose people with AD and have these discussions with the families? And how desperate are patients and families?
Yeah. I have the discussion several times per week, new diagnosis of AD, neurodegenerative diseases. Neurodegeneration means the condition doesn't get better as it stands right now. It continues to get worse. It's probably the hardest part of my job day to day is having these patients with their wives or their spouses, their husbands or children who are with them, their loved ones for many decades of life. It's mostly elderly patients. Yeah. And having to tell them that this is the news, with all the workup. I'm not no better at it. I'm probably even worse every time it happens at doing that. It probably causes burnout. And one of the harder parts of my job, because I'm the one who has to tell them the diagnosis. Yeah. At this point, they've usually had a large workup with me with physical examination, mental status examination, so memory cognitive testing. Yep. They've had a brain scan, MRI, typically blood work to rule out mimics or things that can mimic memory loss or cognitive loss that's separate from Alzheimer's disease, looking at medications, those type of things to rule out mimics, basically.
Sure. And
help kind of confirm the diagnosis. Because right now there's no brain test, there's no scan, there's no blood test that's used clinically ubiquitously throughout the country that confirms Alzheimer's dementia or disease. Yep. It's a combination of things. Now there are studies that lumbar punctures, PET scans that are very expensive, more academic research type of things, not routinely used in normal clinics that are available. And some of them are more invasive or very expensive or experimental. So there are those, but definitely hard to do. Yeah, it gets very hard to treat these people because I say there's no medicines that treat patients with Alzheimer's disease. It's a very large cause of death and disability. Every other cause, heart disease, cancers, strokes, lung disease, liver diseases, infectious disease, accidents, all have effective multiple prevention agents or treatment options. Everything may not be cured, but definitely lessen death and disability, except one, Alzheimer's disease, which is the only one that effectively does not have any prevention or effective treatments as of today.
Yeah. And very tough to tell. So tell the families, thank you very much.
Yeah.
And then you're keeping abreast of what's coming. And so Simufilam is currently in phase 3 trials for Alzheimer's disease. This comes after more than a decade of studies, including phase. This is a long question. This is a long question. Sorry about that. So Simufilam is currently in phase 3 trials for Alzheimer's disease. This comes after more than a decade of studies, including phase 2 studies showing unprecedented data in cognition and biomarker data, as well as improvements in behavior like agitation and aggression, and with anecdotal evidence as well from Dr. Gonzalez Rojas. There have been placebo-controlled trials, year-long safety trials, animal models, and cell cultures, and even a study showing sumiflam has effect in animal models of tuberous sclerosis epilepsy. Are you familiar with all of these studies and data? Have you seen anything like this before? And as a neurologist that is treating Alzheimer's disease patients, what is your view of the drug's safety and efficacy profile at this time based on all of the evidence? I know that's a long question. Thank you.
A lot of questions. Yeah. So I've been kept abreast with the Simufilam trials, the phase 2 particularly, which I've been the first 50 patient data has come through up to 12 months that we know about it at this time. And they're entering phase 3 trials, 2 separate phase 3 trials that are larger, double-blinded, placebo-controlled studies, which is kind of the gold standard for most medication therapies out there. Although we do know from long history, Alzheimer's disease has been around for 100 years since it was first described, over 100 years, 115 years. We kind of know the natural progression of the disease. They continue to do worse continuously. And there's no approved medicines that have long-term clinical improvement, so day-to-day improvement for patients' cognitive function. And I think you brought up a good point, behavioral function too, which was actually very hard to treat. Sometimes the cognition can be, there's nothing to treat it with the things that are out there. And then the behavioral aspects can be very difficult because it changes patients' behavior, their way, their perception with the world, their circadian rhythms, appetite, eating, dressing, having impulse control issues, hallucinations, agitation can be, for caretakers, for family, friends who are caretaking for them, can be very, very difficult. And the early phase 2 trials, which is open label for Simufilam, there was a great benefit to that behavioral aspects as well, in addition to cognitive aspects. And they've been shown that at to date, open label, first 50 patients, that's all I think we have available to date, right? Has continued to show improvement from the baseline. So not only do they prevent them from getting worse, but actually improve from where they were before. I think there's a limit to how much you can physically improve because there's probably already cell damage that's irreversible, but there may be some component that may be at risk, and then Simufilam could kind of help preserve that. Now, longer studies will be very useful to see how long does this go on for? I mean, it was still improving at 12 months. You take how long does it prevent Alzheimer's disease from worsening or progressing? We don't know that yet. At 12 months, which is unremarkable. The question, nobody else has done that. Has been very safe. There's no adverse effect because the main thing we do in medicine, we take the Hippocratic Oath. The first thing we learn when we get the white coat is do no harm. I think that's probably the golden rule, right, of medicine for any good clinician taking care of patients. We don't want to give a medicine that causes harm. And to date, Simufilam is very a specific small molecule, so it only attaches to the altered filament. It doesn't go interacting with other things that we're aware of. So it's been very safe, actually, as far as side effect profile to date with the information we have.
Excellent. Thank you for all of that. And like you said at the end there, a lot of the drugs that have toxicities, it's because they go everywhere, not just in just generally speaking. A lot of the drugs that have bad side effects and toxicities, it's because they don't go just to target. And this one seems to do a good job of high affinity for target. And then one of the things I wanted to say, you were talking about how challenging it can be for families with the behavior. I'd recently heard a story of a family they were so at the end of their rope, they dropped their loved one off at the emergency room and said, we can't take it anymore.
It's very hard. It's hard just not on the patients. What about neurodegenerative condition? It changes it's not like you have cancer, which is a terrible diagnosis too, but you can still kind of have cognition. You can communicate with your families. A lot of times Alzheimer's patients don't recognize that they have the disease because it affects their cognition, right? It affects their psyche, their person, their personality, their impulse controls, emotions, which is what's fascinating about neurological diseases and getting to work with the families and helping explain that to them. It's challenging, definitely. But it's necessary, for these families. But the burden on the family and caretakers is, they're in the trenches, so it's extremely difficult.
Thank you for all that. Great. And then this one's almost as long. There's never been a safety signal of any kind in more than a decade of studying Simufilam, and Alzheimer's disease is always fatal. Nevertheless, a citizen's petition was filed on behalf of a party with a short position, and they petitioned the government to stop the trials. Are you familiar with the petition? Do you have any concerns about anything in the petition? And do you think there's any merit whatsoever to the idea that Simufilam is not safe and that the trials should be stopped?
Short answer, absolutely not. I think it should continue.
Yeah.
I'm familiar with the citizens petition from August. Who it was written by, it's been outed in the Wall Street Journal
Yes.
Recently. I think it kind of speaks merit to who's writing that, right? It didn't come from a peer-reviewed large source, and they made mention to stop it for safety issues, but there's been no issues with safety with this medicine, and all drugs should be tested for safety, absolutely.
Oh, yeah.
Nobody's questioning that, but there's been no issues with safety. So, and the citizen petition didn't make mention of like the phase 2 trials for Simufilam. They didn't make any mention of, refuting that it's not working, the biomarkers aren't improving, patients aren't improving, behavioral is not better. It's hard to fake that in a multiple center facility. So I don't think it should be stopped at all. I think it's more, it needs to go forward, absolutely, to get more data for this medicine, and which is doing in phase 3 trials right now. Yeah.
Excellent. Thank you. That's, I mean, it seems to me as well, but it's great to hear it from a neurologist. Thank you. That treats Alzheimer's disease patients every day. Thank you. Great.
Absolutely.
Speaking of that, you had patients this morning already. You work with these desperate families closely. What would it take for you to start prescribing Simufilam to patients? What else do you need to see to say that this looks like the best path forward, the best risk-reward intervention known at this time, and that you think it should be prescribed to AD patients?
So typically kind of what we've had until a few months ago, there was only 2 classes of medicines: acetylcholine blockers, or esterase inhibitors like donepezil to increase acetylcholine, which is kind of the same receptor that Simufilam, the mechanism of action, works on, the nicotinic acetylcholine receptors. And does donepezil work? Yeah, for like 3 to 6 months. It can help slow the decline, in most patients. And then the effect wears off. It's these receptors, you're increasing acetylcholine availability, and then after being banged on for 3 to 6 months, they kind of give up and like this is it. NMD antagonists are the other class. The Memantine is the one, and then we I think many people are familiar with aducanumab and the large biologic amyloid antibodies. So none of those have good evidence of clinical benefit, and some of them actually have a lot of side effects. All of them, including the more recent ones. So I describe it, and people will come up like, "Hey, I heard there's this new medicine, aducanumab for Alzheimer's," and I say, and a lot of them say, "That sounds like a terrible medicine. I wouldn't want that for my family. What am I missing?" They go, "Doctor, what am I missing?" Like, I'm not a doctor. I don't know. I go, "You're not missing anything. You're actually very smart for picking that up accidentally." So it's very hard to treat. Moving forward about your question, what would it take for Simufilam to be approved? Just FDA approval, I think, at this point, because there is nothing else. It's one of the only diseases with there's no other treatment to help people right now, and they're very desperate for some help.
Yes. Yep.
Real people, real patients.
Yep. Thank you very much. Someone in the comments here just said, "Well, how come aducanumab didn't have a citizens petition to stop that trial?" And so
it's a very good question. It's a very good question. A lot of evidence that a lot of side effects, very serious side effects, life-threatening side effects, and it didn't help cognition, didn't help people day to day. Did it improve their amyloid levels? Yeah, but patients don't come in and say, "Help me improve my amyloid levels." They go, "Help me function better." They help cognition, help grandma, help my wife, help my aunt and uncle, help my dad. That's what people are asking for, not amyloid levels. So, and obviously the side effects. Patients don't want that. No. I don't blame them. I would never prescribe that.
I wouldn't either for my family either. Thank you.
Yeah, absolutely.
And then, so Alzheimer's disease has been so hard to treat for so long. As someone that you've looked at Simufilam, you've looked at aducanumab, you've been looking at the other stuff. So as someone who looks around, as someone who's qualified, who's been looking around, is there anything else as exciting as this out there that you are seeing?
Yeah, as an academic neurologist, we look at any condition, evidence-based medicine, right? That's how we foundation what goes through the Academy of Neurology, kind of expert opinion, consensus opinion, recommendations for treatment. That's what we're looking at. Alzheimer's is almost like an orphan, because there's nothing effective to treat it but it's not rare. It's super common.
Right.
So there's nothing else that I've seen that has gotten me anywhere as excited as Simufilam. Some people have asked patients, I tell them the options, and maybe they tried the ones that are on the market, the oral medications, and didn't work or had side effects. And I get that. Yep. They don't want anything to do with the infusions. And I totally agree. So they asked, is there anything new? And I kind of make mention about this kind of, generally speaking, there's a medicine out there that has some very good potential out there. It's not approved yet, so we don't know for sure.
Yep.
And they're like, can you write my number down and call me as soon as it's approved? And I've had patients actually get the website, and they're on the newsletter to get updates, because these patients and families are very active online, reading about stuff, and they're interested, and they're very excited as well.
Yeah. Wow.
It'll be a great day. Yeah.
It would be a great day. Yeah. That'd be a great
Absolutely.
Day. Great.
Yeah.
And then you touched on this earlier about the multimodal diagnosis, but how hard is it so how difficult in general is it to diagnose Alzheimer's disease? And then, and can we have your opinion of Alzheimer's, of Cassava's blood-based diagnosis technology, and how important it could be?
Yeah, so 2 questions. So perfect, very good questions, Joe. So the first question is, how hard is it to diagnose Alzheimer's? Like I say, a lot of patients, when they come into a neurologist, they need extra time, because it's not diabetes. We get a blood test and it tells you it's above this level, it's this. The computer could tell you get diabetes, really. Alzheimer's is harder. There's not one test. So we go through a history, go through an examination, a lot of questions. I usually do a MOCA examination, which is used for cognition. And cognition is not just memory. People can have trouble with language, attention, executive thinking, visual spatial processing. Again, history a lot from family members who can see the patient better. A lot of times the patients will kind of deny they have issues, or it's hard to self-reflect on that.
Of course.
Looking at images, and not just in reading images, looking at them, looking at some blood tests to rule out mimics, or things that could do it, medication effects, depression, things like that.
Yeah.
So all that together, Alzheimer's is probably underdiagnosed.
Yeah.
I would definitely say, because there's no great incentive to diagnosing it, because it's not a nice thing to tell people. It's a hard conversation.
Yeah.
A lot of people, it takes time. You want to do it, and there's no treatment. So, I mean, the ones that we do, we give the Mepazil because we have nothing else.
Right.
But it's not hard. But the diagnosis itself, unless there's a lot of other things going on, they've had strokes before, a lot of depression, it can be a little harder to tease out sometimes.
Got it.
But I think for most of the time, with the time and with the workup, it should be, pretty good to come up with a reasonable explanation, a reasonable diagnosis, I think, in most patients.
Okay, interesting. So, and then you mentioned the comorbidities could hide it. And then the other thing you were saying is that you have to basically sort of wait until there's a problem. So if there was a good medicine like Simufilam, then you couldn't start.
Yeah, so that ties in nice with the Sava Dex question, the blood-based test, which is, to my understanding, Cassava Sciences, a serum test, a blood test that can check for altered filament A, the protein. Mm-hmm. So I think the golden, holy grail of Alzheimer's would be easy early screening and detection, and not through invasive lumbar punctures, expensive PET scans, which we can't go through everybody and screen that. Everybody kind of 50, get, your cholesterol checked, your blood pressure check, colonoscopy, mammograms for females at a certain age. That's typical, but these things are a little more complicated for Alzheimer's disease, and we're not very good at predicting who's going to get it. So if you could get screened for Salvadex early, if it's validified and shows that it works and effective at screening, at least screening for it early, because what we know is that the changes in the brain can occur years to decades before people have clinical symptoms. So if we could put them on a safe prevention, almost like a vaccine, if you will, or to prevent serious worse, possibly Simufilam early, before they develop cognitive impairment, before they have issues. Dementia means they have multi-domain cognitive issues and interferes with the ability to perform daily functions independently. That's not a good place to be. So you can catch them even earlier. That's kind of the holy grail, I think. And that's what gets me super excited about Simufilam. Has that potential to do that in the future. Yeah, if it's studied. Yeah.
Thank you. Do you have any feeling of when the disease might be starting versus when the symptoms manifest? How much earlier they might? I'm not sure that's people know or not.
Yeah, and that's a good question. So they think years to decades early.
Oh,
There's
really?
probably some
Wow.
breakdown
Yeah.
and changes in the brain, and that includes inflammation, buildup of amyloid and tau, which we know are downstream products. Probably not upstream. You need to look at all the biomarkers, and Simufilam has a great improvement, broad spectrum biomarkers, which shows that it's probably an upstream process
Yes.
at this point. We don't really know for sure what the upstream process is at this point. We know downstream there's amyloid and tau that
Yes.
gets built up. So we'll see.
Their theory is that there's misfolding proteins, and then that starts a toxic cascade, and that's their theory. And then
Yeah.
so they would be upstream of the whole cascade of the process. So if that's the way it works.
Yeah. So, you can definitely start years early. Typically, what we say is prevalence, and that's how much of a population has Alzheimer's disease. And there's kind of an easy way to remember it. I like easy ways. It's easier to remember. At 60 years old, with 1% of population, and every 5 years, you double the percentage. So 1% at 60, 65, it's 2%, 70 is 4%, 75 is 8%. And you can kind of increase that. And that's prevalence. That's, of all the people in the country, how many have it at that age? So by the time you're 85, it's like a third or something, very high. And there's just people are living longer, for other good reasons. That increases the burden of total Alzheimer's disease. And Alzheimer's, I see them a lot, if they're admitted to the hospital, it's not a good disease if you're admitted to the hospital for other reasons. They get encephalopathy, which means very bad confusion, delirium, disorientation.
Wow.
If they get infections or falls or break a hip or strokes, they just do poorer because their brain reserve is so much less, unfortunately.
Wow.
And it's very hard for them. Yeah.
And then the whole baby boom generation is going to that age now. And wow.
Absolutely.
Yeah. Thank you.
Yeah.
And
a lot of neurologists are going to be retiring, so we won't have anybody to diagnose it. So there's not as many neurologists. So.
You mentioned this, but just real quick, Simufilam is a pill you take at home. Biogen and Lilly's dubious treatments are infusions that you have to go to the clinic, probably have a caretaker take you to the clinic, and then you get a needle for like half an hour. People won't like that. So does that matter to you, and do you think that would matter to your patients?
A lot, I think. Infusion centers, which is required for those large biologics, because they're large antibodies. They have to cross the blood-brain barrier in large volumes. These infusions have a lot of side effects when you're getting them. Neurology, for other conditions, we use IV medications, IV steroids, IVIG, a lot of MS drugs. Not all of them. Some are injections, some are pills, some are infusions. We do it, So it's not that it's the infusion. It's also the side effect that like 40% of people have serious side effects to these large infusions, and they're clinically not better. But a pill is much easier, especially patients in rural places. I do underserved areas. So a lot of these people come from areas a lot of people don't live in New York City, right, and can go to a big hospital with IV infusions. They live in rural America. Wow. A lot of them are underserved areas where they have doctors in hospitals, but maybe not huge IV sites. They're harder, much easier for compliance to remain compliant with twice a day medication with essentially no monitoring. Yeah. Even if you're wrong and you give it, it's not hurting them, right. So I think the opportunity to hopefully try to do better and benefit them, it would outweigh that, I think, especially with a good safety profile.
Yeah, that's a great point about the safety profile. If they did forget they took it, they could probably take a second pill when there's no toxicities. It's not a big deal.
Absolutely. Yeah, I read somewhere where this dose is like less than like a tenth of the toxic dose or something like that. So it's very, it's been helpful. So
excellent.
I'm not sure if that's right, but I did read that once. Yeah.
Great. Super. Thank you. And then the evidence for Simufilam is quite encouraging. If it does, in fact, work as intended, what kind of improvements can we expect to see in the practical world for patients with Alzheimer's? Yeah. If the patients you work with, if they start taking Simufilam, what kind of improvements would you expect to see?
Yeah, so if you look at the studies, the phase 2, they use this ADAS-Cog score. And for people who are not familiar, it's a score from 0 to 70. And it's like golf, lower is better. So if you got all the questions right, it's a test. It's a verbal test, written portions too, cognitive test. So 0 is like you got everything right. It's like a perfect score. 70 is the worst, although most people don't get near that high. And normal, some people can miss a couple and it's still considered normal, and they're like in the low single digits. You get to 10, the high teens, 20s. That's kind of more like moderate severe dementia. Believe it or not, it's pretty high.
Okay.
And they were improving by like 3 points, as opposed to getting worse by
Right.
5 points after a year, which is an 8-point swing. So that's actually quite dramatic. And I think you said from the anecdotal evidence from people who have seen these patients, I've never seen a patient on Simufilam, but from people in the clinical trials, they can remember things more. Imagine, going to a room, forgetting your purpose, forgetting families' names.
Yeah.
That's a big thing. Forgetting your name, date of birth. That's a huge thing. That's what people bring up the most, is like, he doesn't remember the grandkid's name, grandpa or grandma.
Yeah.
And that's hard.
Yeah.
And then also behavioral stuff. People could probably stay at home more, and they're actually better if they stay home. It's a more familiar surrounding area than going into another facility, which has a lot of other potential issues.
Right.
So,
I didn't think of that.
a huge thing for fit family and the patient. So that's what I would expect, hopefully. And as I mentioned before, I think the ultimate holy grail would be the prevention aspect, like very early.
Yes. Yeah.
So people can stay functional in the workforce longer, and not wait till they get dementia. Maybe catch them earlier and get those people, prevented. So I think that would be fantastic.
Yeah, I do too. That I completely agree. To start it way early. Absolutely.
Yeah. Yep.
And then along the same lines, there's the CMS study. So there was that 12-month open label study you talked about. From there, patients went on to enroll into a placebo portion extension, and some stayed on the drug. Some came off for 6 months, and so there's a placebo portion. So the placebo study, it's a placebo-controlled study where half the patients were on the drug for a year, come off for 6 months, while the others stay on. Very interesting study. One concern I have about its design is that small molecules targeting misfolded proteins tend to build better effect over time. We've seen that in a number of small molecules targeting misfolded proteins. So is 6 months enough for the degradation to show itself again? Could it be that these patients are healed and then they don't fall off in 6 months, and then it looks like the drug is not working because it works so well?
Yeah. So if you're thinking the drug helps course correct, or it's not just a symptomatic treatment, right? So it affects the underlying condition. It's an excellent question. I think about that. I just wonder from a scientific curiosity standpoint. So basically, somebody who's already getting Simufilam, then they stop taking it for 6 months. Do they still coast, or do they have like a slower worsening return to where they would have been? Which is what happens with like donepezil. Even if they take it after 3-6 months, they end up where they would have been anyway.
Right.
I don't know. That it'll be very interesting to see. I think that's why the phase 3 is like just designed better, because those people haven't, like, some have placebo and some are getting Simufilam, so they haven't been previously exposed. I don't know how long it stays binded to the filament. I have no idea. It's very interesting.
It's a very good point. On one hand, it doesn't really matter because the phase 3s are not designed that way. But so that'll
right.
So
I think so. But the phase 2 is interesting, but I don't know. I wish I knew. It'll be very interesting.
It'll be interesting
because
you kind of hope that the study fails and they stay healthy, so there's no difference. But then the study fails.
Yeah.
So.
Yeah, but it's just one portion of it. I think the phase 3 will be. The phase 3 will be. And the phase 3 is very large. I think there's like 2,000 people total. It's
right.
Great.
Like 1,000 in each about. Yeah. Great.
Sure.
And then I'd like please to talk about breakthrough therapy designation. So the FDA lists 2 conditions for breakthrough therapy designation. The first one is that the drug should be intended alone or in combination with one or more other drugs to treat a serious or life-threatening disease or condition. Well, Alzheimer's disease, a very serious life-threatening disease, and it's intended to treat that.
Absolutely.
So that one, it's covered. The second condition for breakthrough therapy from the FDA is preliminary clinical evidence indicates that the drug may demonstrate substantial improvement over existing therapies on one or more clinically significant endpoints, such as substantial treatment effects observed early in clinical development. So this is treating a very serious disease. Can you please give us your opinion on whether Simufilam currently satisfies that second condition, and if the drug should be given breakthrough therapy designation and made available to patients as soon as possible?
I think just broadly from what we know so far, I think it would meet that clearly. It's basically an unserved medication, a huge need, huge death and disability, progressive problems. People have it every day, are getting diagnosed or passing away from it, unfortunately. And none of the medicines available are effective, essentially. Not disease modifying at all, definitely not. More kind of symptomatic. how much patients do they need to see to get, breakthrough drug therapy or approval? The FDA may need more than this. I think it's the first 50 that we have in the open label.
Yeah.
They may need more than that. I don't know. So I don't know what exactly they're going to be waiting on.
Yep.
Maybe more patients to come through the phase 2 trial as more of that data gets accumulated, because I think people are still in the trial or still going through it. They might not be at that time frame yet.
Right.
I'm not sure, but so they may be waiting, or some early phase 3 results potentially. So I don't know, but it's a very good question. I wish I knew, but I think it's very promising at the prospects of that happening in the future.
Excellent. I would tend to, that's a very fair
Yeah.
answer. Yeah. Thank you very much.
Yeah.
Well, I thank you so much for your
Yeah.
time. You've been
Yeah.
so did you
Yeah.
have any? You've been so generous with your time. Did you have anything else you
Absolutely.
wanted to say to us or anything, just in case? I mean, you've covered everything, but
No, I think we covered everything,
yeah,
all the talking
yeah,
points I wanted to share with everybody, and just kind of share my expertise as a neurologist who, sees these people day to day, and what we're up against. And it's a real thing. And I kind of think when I go in and diagnose the patients, then I'm handcuffed. Like, I have no real effective treatment options. It's like fixing a car with, like, in your toolbox is a cup of coffee in it. You're not going to do anything. You can still educate and help people, and then they can learn about it. I
yeah,
think that's very helpful in what to expect. But as far as, we want to help, we want to treat people. And a lot of other neurological diseases over the last, even during my training, the last decade, has had phenomenal success in new therapies for them,
yeah.
except Alzheimer's,
Except Alzheimer's.
essentially. Yeah. So it's very promising future. It's very exciting to be a part and see what happens.
Thank you. And you're getting a lot of thank yous on the comments here.
Perfect.
So on behalf of everybody, just
Cool.
Dr. Boyer, thank you
Great.
so much for making the time for us. Thanks
Oh,
for
yeah.
waiting as I got the Zoom going
Yeah.
too. Thanks for your patience as well.
That's okay.
Yeah. Cool.
Thank you, Mr. Springer. Thank you for allowing me the honor to come onto your program. Thank you so much. Great questions.
Our pleasure. Please come back anytime you want. Thanks so much, Dr. Boyer.
Okay.
Okay.
Bye, everybody.
All
Good
right.
luck.
Thank you.
Have a good
Bye.
day.
Thank you.